Hi, my name is John Garbon from DPA 202,
Ay, talaga? Ah?
and we will talk about non-communicable disease and communicable disease.
Ang galing mo, Anggoy! Ang galing!
And in this video, we will talk about what is their meaning and what is their difference. And also, we will give at least two examples of this disease. So first thing, we will talk about the non-communicable disease, or also known as the chronic disease. Tend to be a long-term or a long duration, and are the result of a combination like genetic, physiological, environmental, and behavior factors. Or in short, this non-communicable disease, also known as long-term illness. And non-communicable disease are ones which do not spread to one person to another. Others refer them as the non-contagious disease. Or when you say contagious, this is a disease where you can spread one person to another. And this is the example of non-communicable disease. The first one is the cardiovascular disease. When you say cardiovascular disease, a type of disease that affects the heart or blood vessels. And this is the sign of, or the symptoms of cardiovascular disease. Like pain or pressure in the chest, pain or discomfort in the arms, left shoulders or right, elbows, jaw, and back, and short of breath, and cold sweats. Next one, example of non-communicable disease, the diabetes. We all know what diabetes is, and it is a serious matter. So the diabetes, disease that occurs when your blood glucose, or also called blood sugar, is too high. So this is the symptoms or sign of diabetes. You need or pee a lot, often at night, and very thirsty, lose weight without trying, you are always hungry, and also have a blurred vision, and have numb or tingling hands or feet, and feel tired even though nakahiga ka lang or wala kang ginagawa, and you have also very dry skin. Next one, the communicable disease, or also known as the contagious disease, which means this disease spread one person to another. Like for example, this HIV or AIDS, and also this disease through a variety of ways that includes blood or blood fluids or body contact. And as I said, HIV is the one example of communicable disease. In HIV, a virus that attacks the body immune, and if HIV is not treated or hindi agapan agad, it can lead to AIDS. And there is a currently effective cure, and once people get HIV, they have it for their life. And the symptoms of HIV is the fever, headache, muscle aches, and joint pains, rash, sore throat, and painful mouth sore, diarrhea, and weight loss. If you know body contact with, or if you know how to use the safe sex. And next one, example of communicable disease, the hepatitis B. When you say hepatitis B is a vaccine preventable liver infection caused by the hepatitis B virus. And hepatitis B is spread when blood or semen or other body fluids from a person infected with the virus enters the body of someone who is not infected. And the symptoms of hepatitis B is the fever, fatigue, loss of appetite, vomiting, abdominal pain, and dark urine. So, we can avoid this, no? Like for example, this non-communicable, reducing the major risk factors for non-communicable disease or the NCDs, no? Tobacco use, physical inactivity, unhealthy diet, and the harmful use of alcohol. And so, how can we avoid the communicable disease? No? Wash and dry your hands regularly as well. Stay at home if you are sick and go to hospital no, pag lumana talaga siya. Huwag nang patagalin pa. No? Of course, cover your mouth no, if someone sneeze or cough to you, and clean your surface regularly, and prefer safe food and practice safe sex. So let us define what is the difference between non-communicable and communicable disease. No, easy lang siya. So non-communicable disease, it's a disease not contagious or is not spread to one person to another, and the communicable disease is a contagious. No, it can spread from one person to another. That's all, and thank you.